Hi, and welcome back to Hill and Ponton's Veterans Disability blog. I'm Natalia Joffrey, the company COO,
And I'm attorney Allison Reddick.
and we're continuing our new format to stay happy and healthy, right, Allison?
Yes, social distancing.
Social distancing at its best. So today we're going to be talking about VA disability for heart conditions. So, Allison, first question for you are, what are some of the most common heart conditions you see to file claims for?
So, as we live in the United States, we know that heart disease is one of the main contributors to death in the United States, and that does not separate veterans at all. There are numerous heart conditions. Some of the umbrella terms that are most recognized would be coronary artery disease, which is also known as ischemic heart disease. Congestive heart failure is a big one. Hypertension is a huge one, as well as arrhythmias and atrial fibrillation, also known as AFib.
Yeah. Okay. How do you get direct service connected benefits for a heart condition?
So for a heart condition would be like any other condition trying to get direct service connection. You need a diagnosed heart condition, whether it be coronary artery disease, ischemic heart disease, etc. This incident or condition that may be symptoms in service, and a medical nexus to show that the two are linked together.
Okay. I was previously talking to Melanie a couple of days ago, and we were talking about the link with hypertension, diabetes, and how the medication for hypertension can give you. Talked about Agent Orange and the presumption with Agent Orange and diabetes. And so, my question to you is, are there any heart conditions related to Agent Orange, and how does that work? Are there any presumptions there with heart conditions?
Oh, absolutely. I would say heart disease is probably one of the largest conditions that are claimed for Agent Orange presumptive conditions. If you can show that you were exposed to herbicides, whether you were boots on the ground in Vietnam, or now with the new act for Blue Water Navy, if you were within 12 nautical miles, as well as some Thailand veterans and Korea veterans, then basically you don't need that nexus. You still need a diagnosed condition. And then your service in one of those areas makes it presumptive that it's assumed, okay, you were exposed to Agent Orange and you have a diagnosed heart condition, then you get presumptive service connection.
So is it the same in that if you were in a certain place at a certain time, it is presumed that you were exposed to Agent Orange, and therefore if you have this heart condition, there's that connection? Is it automatic?
Yes.
Okay.
Yes, depending on the area. So Thailand and Korea, there are caveats that you need to fulfill. But for the 12 nautical miles, being a blue water veteran or boots on the ground Vietnam, then it's automatic. However, one of the conditions that is very prevalent is hypertension. And that is not a presumed condition, even though there is tons of evidence showing that hypertension is caused by Agent Orange. So that is a situation where you can still claim it, but it's not presumptive. You don't get that presumptive. You have to claim it direct. You have to provide that nexus opinion.
That's where you come in, right? With your attorney superhero powers.
Absolutely.
There prove that connection.
Yes, there are, and there's an umbrella term that it's coronary artery disease or ischemic heart disease. But there are so many conditions that may not fall into it. And that's where we come in to be able to provide a nexus if necessary.
Okay, great. What are some possible secondary service connections for heart disease or heart conditions, pardon me? And also, backup question is, how does obesity play a role? Because I often see that connection.
So there's two ways to come from that. There is, you have a condition and then your heart disease is secondary to that condition. So that would be conditions like diabetes. potentially PTSD. You have a lot of anger. It increases your blood pressure. It causes heart disease, causes hypertension. Medications can also cause some heart conditions. And then there's the flip side. You're service connected for a heart condition, and you have secondary conditions to that. A heart attack would be a condition, stroke, atrial fibrillation, sleep apnea, hyperlipidemia, chronic kidney disease. And obesity does play a large part in a lot of these. If you have heart disease and you're fatigued and you're short of breath, you can't exercise as much. So you develop obesity. And obesity alone doesn't contribute it, but it's kind of a step between a service connected condition like heart disease and another condition. So let's say you have coronary artery disease, and it's severe to the point where you can't exercise. It's hard for you to do your activities of daily living. You gain a lot of weight, you become obese, and then you develop diabetes. So obesity is kind of that step in between the two conditions, but shows, okay, I have this service connected heart condition. I became obese. And because of that obesity, I developed diabetes.
Gotcha. It's almost like you're playing connect the dots, isn't it? Like
Yes.
this links to this, and then that links to the other.
Yes.
Yeah.
It's a puzzle.
It is a puzzle. Yeah. How are heart conditions rated by the VA?
So heart conditions are rated based off of testing. It can be a physical test, like a stress test on a treadmill, where you run and as much activity you can complete at certain strenuous levels. That's how it's calculated. Or it can be interview paced testing if it's unsafe for you to complete a physical test. So how they do that is they rate it based off of your METS testing, which is metabolic equivalence test. And that's what they figure out based off of the physical stress test or asking you questions about the symptoms you have. Basically, the lower your METS rating is, the higher your rating is going to be. So 1 to 3 METS is if you're having issues with your activities of daily living. Getting dressed, you're getting short of breath. Taking a shower, you're fatigued. Eating, slow walking a block or two, you have to take breaks. That would be 100% rating.
Okay.
3 to 5 METS would be like doing light yard work, some weeding, brisk walking. That would be a 60% rating. 5 to 7 METS is walking up a flight of stairs. You're getting more strenuous. Mowing the lawn, that's a 30% rating. And then 7 to 10 METS, jogging, more strenuous activity. You don't really have any limitations at all. That's a 10% rating. And a lot of the time I see that the veterans are given lower ratings, 10%, 30, when in actuality, they probably deserve a 60 or 100% rating.
Okay. And that was my next question. So can you get 100% VA rating for heart conditions? So the answer is yes.
Yes, absolutely. I mean, a heart condition can be absolutely debilitating to the point where if you can't complete your activities of daily living, you have shortness of breath, fatigue, chest pain, weakness. Some people even have fainting spells. You can't really do anything without symptoms. Then you absolutely can get 100% rating based off that 1 to 3 METS rating. I'll clarify that in the interview-based stress test, they're going to be asking you questions like, do you have shortness of breath when you're getting dressed, or chest pain and things like that? So that's how they determine the METS in that way, if you can't do the physical test.
I've heard of temporary 100%. Does that exist? Is that a thing?
Yes. So there are certain conditions or certain surgeries that you can have where you get a temporary 100% rating. So like if you were to have a heart attack, you're rated 100% for 3 months. And then after that, they reassess to get a new rating for it. If you get a pacemaker put in, you get a temporary 100% for 2 months after your surgery. Other surgeries like heart valve replacement, I believe that's 6 months you get 100%. And then if you have a heart transplant or heart replacement, that's you'll get a year of 100%, and then they'll reassess all of those after those time periods lapse.
Okay, super, super helpful. Can you get benefits for harmful side effects due to heart condition medication? And we see this a lot, don't we? Where sometimes the side effects are almost as detrimental as the condition itself. So can you get service connected benefits for that?
Yes, and it's to the point where someone's not going to take a medication unless they have to if they're having these debilitating side effects.
Yeah.
So, in these cases, you're probably going to need a nexus to show that because of the heart medication you're taking, it's causing harmful side effects, and so you can
Mhm.
get secondary service connection for that. So, an example would be you've tried all these different heart medications, but there's just one that works for your condition, but you have debilitating headaches.
Mhm.
You would get a nexus to show that there's nothing else that's causing these headaches. It's the heart medication, but you have to take that medication in order to control your heart symptoms.
Yeah, in order to survive. And that is a common one, isn't it? With the heart medication and the headaches. I hear that a
Yes.
lot. Yeah.
Yes.
Can you get IU for a heart condition?
Yes.
I guess maybe
So
tell people a little bit what IU is, and then can they get it for a heart condition?
So if your heart condition isn't severe to the point where you have 100% scheduler rating, you can still potentially be paid at the 100% rate through individual unemployability. So basically, what that means is you have a rating lower than 100%, but your conditions are so debilitating that you're unable to work. In order to get IU, you have to have at least one condition at 60% or multiple conditions at 70%, with at least one being rated at 40%. So
Mhm.
if you're not 100% for your heart condition, the next lower is 60, which that qualifies you for individual unemployability. It would be one condition at 60%. So if that condition is debilitating to the point where you're unable to work, you're unable to go into the office or even do sedentary work because you're getting shortness of breath, you're fatigued all the time, you're having to nap, it's your side effects from your medication, you definitely can get individual unemployability. Or let's say you have 10% or 30%, but you have other conditions that your combined rating is 70%, with at least one condition being 40, you can get individual unemployability that way as well.
Okay, so lots of different ways to get benefits, and kind of depends on the person and what their circumstances are, right?
Yes, absolutely.
Okay, great. Well, this was helpful, Allison. Thank you so much.
Thank you.
All right. If you have any questions, feel free to visit our website or call our office. Thanks for joining us.